Hi everyone, this is Raul Pinto and we are starting a new episode of a Small Talk, a little time that we have every week thanks to RNAO, where we can talk about issues related to healthcare. And today I'm thrilled to be here with Laura Guerrero. She is the coordinator of the Latin American COVID Task Force. This is a group part of the Latin American community. They got together in these difficult circumstances to install these pop-up clinics for everyone. But if people can speak Spanish, they can just go there and get their vaccine. It's very simple. And we are very happy to have you here. Laura, how you doing?
Very good. Thanks for having us. Thanks to RNAO for this space.
No. Thank you for doing what you're doing. And first of all, I want to know how did this all started? Tell me a little bit about the story of this.
Well, this all started over a year ago when we started to realize the impact that COVID was having in all racialized communities, but particularly the impact on Latin American communities. So a group of us, we were friends, we knew each other from the sector, and decided to follow the footsteps of the South Asian colleagues that had already established the South Asian Task Force. And we thought this is a good idea to put our heads together where we have folks from the front line that work at hospitals, we have professors, researchers, physicians, nurses, PSWs who said, we want to do something for our communities. And we came together like after work, and although the shifts during COVID were ridiculous, as you know, we have physicians who step out of their shift just to participate in our meetings and try to organize a strategy to respond to the issue that we had in front of us, which was our Latin American community members, particularly the most vulnerable in our communities. And I'm talking about non-insured farmer workers and people that work in the sector and not necessarily share the gains of an economy that benefit from their work. Unfortunately, we're being the harder hit in our community, and we needed to do something about it. So we organized to start knowledge exchange, education in Spanish. We had our physicians doing forums in Facebook, social media, in WhatsApp groups, organizations that will invite us to present to their already established groups, mainly virtually. And that's how we started. But then early on, we realized that we needed to do a lot of education around vaccines. So before the vaccines arrived, we had tons of events, again, mainly online, but reaching all kind of community groups in all ages as we could to try to start wrecking some of the myths that we knew were coming through social media and debunking some of those myths and false news that were getting so into our communities in various ways, working in partnership with our media and healthcare partners, just to provide that education, that information, reaching that gap in the knowledge exchange, because the information wasn't there in Spanish and it wasn't reaching the people that we wanted to be reached. And that's how we started it. And then it developed in partnership with healthcare workers to start this vaccine clinics. We partner, we really are our support team, like our physicians, again, will volunteer their days and vaccine there, but we also have hundreds of volunteers from our community who step up and say, I can translate, I can do logistics, I can set up. And that is how we engage over 200 volunteers that have been supporting our efforts across the GTA. But it really is the healthcare leads, the agencies such as Humber River, Black Creek Community Health Center, Sherburne Health Center, Peel Public Health. Really, they have been the leads on these clinics. We are there to support and to make sure that folks who speak Spanish, folks who are not insured, feel safe in the space, understand, and sometimes don't get the vaccine, but they get their answers to their questions, and maybe they come back, the following week and get the vaccine. It's all about respecting people's times and decisions and understanding, that folks have questions as well, and give them the time to process the information they need to process to get to what we eventually want, which is getting protected, getting the vaccine.
When we were at the height of the pandemic, I can imagine the getting together to create these kinds of group where it was like working in a storm, right? In a yes. tornado. It was probably like a chaos around. How did you guys understand each other and try to work fast? What was the mainly motivation, and how was like the first time that you get together in a place to do vaccination?
Well, the first meetings occur usually as around 6:30 a.m. or 8:30 or 9 p.m. To accommodate the physicians in the room, the schedules of folks. It was mainly virtually. We actually met for the first time in one of our the largest vaccination clinics that we did with Humber River. That was the first time we saw each other like face to face and well, with masks, but we couldn't believe that, we worked together all those months and some of us never even met in person. I think that was amazing. I think the commonality here is the understanding that this was something that we needed to do. We wanted to do. I think there's solidarity that drives communities. And I think, really our providers felt that they needed to do something more than their 16 hours of shift that they were doing. And outside of the work, this is like a moral obligation that we felt to support our communities and to support the folks that we knew were struggling the most in our communities. The first clinic came together through Humber River Hospital in a partnership with the San Lorenzo community as well. And that was an amazing movement of individuals. We put a call for volunteers and the call out was overwhelmed. Like we got over 200 people that wanted to volunteer. We have to, sort that out and narrow it to a list of 80 folks that supported the 2 days. It was a massive clinic, and it feels just the right thing to do. And I think all the folks in the community, a lot of people from the education fields, from U of T has a large group of Latin American students who organized and said we wanted to be there, and they were there. And I think it's really that is people from the culture, culture, media, education, like all the fields that just step up and say, we also want to support. Like, it's not only you healthcare folks who are together, like we wanted to support these efforts to benefit our community and the communities that, are most vulnerable in our communities.
Absolutely. And we also spoke with Nayiberts. She's a registered nurse, and she talked to us a little bit about this, her participation on these clinics, and this is what she said.
There was obviously a need for information, guidance to particular populations, right? So, and then Latin American tasks in regards to COVID-19 and the vaccines. So, so I was invited through a friend of mine. She brought the idea that there is this movement going on to help the community. Are you interested on? And I just say, yes, of course. So, so then that's how I joined. And then I met Laura, Natalia, and that's how I got involved in it. Yes. It is very strategic and very effective because it brings the vaccination, it brings the information to where these Torontonians or from Brampton or across Ontario, where they carry out their everyday lives, right? So it is very convenient, it's very effective. They don't have to be doing bookings. They just go by, they get information, they get vaccination, and boom, they have it.
Laura, this is my last question for you. You have mentioned that you guys have translators inside, and of course you are preparing this and promoting this event among the Latin American community. Why do you think it's important to have a place like this for people in their native language? There's also this idea that said, if you come to Canada, maybe you could learn, to speak English or French. But there's a lot of elder people coming here and people who just for different reasons cannot learn the language properly, or they're a little afraid. But why do you think it's important to have this, especially for the community? And did it work? Like, Latin American people came and participate because it was made for them? What can you tell me about that?
Well, we have clinics in Toronto that have had people from Hamilton come in because they knew that they could get the vaccine in Spanish and they could get access to a physician in Spanish. We have people driving from Mississauga, Caledon, from, all the way from the east, past Scarborough, all the way from, everywhere where, they just heard that Spanish services were provided, and they came. They did the drive, and they make the effort. And I think that speaks clearly to us that there is a need. Beside the fact that really in our clinic, most of the people that were served speak only Spanish. I think folks need to understand the political context. I think it's not only seniors. There is forced migration in Latin America, and a lot of our countries that are forcing people out of their countries, and that have been historical. It's not new. We've seen it across, Latin America over the years, and that continues to happen. And people need to understand the circumstances in which people arrive to a country, and not all of us, have the privilege to get into a school, pay our education, and learn the language. A lot of people just, are doing what they can, and what we need to do is making sure that healthcare that is recognized as a human right is accessible. And the way for us to making sure that happen is not only speaking the language, is trying to make sure we go into the neighborhoods and let them know that these clinics are available, let them know that the healthcare is accessible and is free, and the vaccine is free and won't have cost, that the system will protect them, and that information will remain confidential for those clinics, and it won't be shared in any other government structure or institution. And I think all of that could only happen when you speak the same language, when you have the people that have the training to have those conversations. Even if you don't speak the language, I think there are a lot of community agencies that do amazing work in making people feel safe. And I think that's something that have been really happening a lot across of these pop-up clinics. And I want to say thank you to all the organizations that have understood that and make sure that this is a safe space for individuals. For those who haven't get it yet, I said, if you have questions and you want to have a conversation in Spanish, please do engage with us. Let us know. We have physicians who have answered one-on-one conversations, have had phone numbers of individuals who want to connect and still have doubts about the vaccine. This is one of the things that we want to do. We want to make sure that the conversations can happen judgment-free, and that slowly people increase confidence and eventually get the vaccine.
Perfect. Laura Guerrero, coordinator of Latin American COVID Task Force here in Ontario. We thank you for your time today. We thank you for your courage, for your hard work, for everybody. And we are celebrating Hispanic Heritage Month during October. I know there is some controversies, right, because of colonizers and people in Latin America with different views. But at least we can celebrate that we are Latinos, that we are Hispanos, that we have different roots from different places, and we can get together to do something like this. We can be celebrated for our food, for our beautiful landscape in our countries, for our music, but also we can celebrate because we have a great group of doctors here that are doing their best to get us all out of this pandemic. Thank you, Laura.
Thank you. Thanks. And viva la latinidad, and viva la comunidad.